Hi dear friends, welcome back to my channel Alpha Physio Pelvic Care. My name is Anastasia Varova and I'm pelvic floor physiotherapist here in a beautiful sunny Cyprus as well as online. And if you're first time on my channel, I'm sharing here everything pelvic floor health related and beyond. And today I would like to share something that for me as a pelvic floor physiotherapist seems to be so obvious. I mean, we talked about it 300 times, but I must remember that this is something that I do every day and I see it across many people. Whilst the person who would come to me, they will probably hear about it first time, they will hear about pelvic floor for the first time. So it's very, very important to explain to them and to you, my dear friends, the three most common mistakes that I see in pelvic floor exercises. I will demonstrate them to you through very simple basic exercises, but they can come through any type of exercises, something very basic, something not so basic, but let's have a look at them. And hopefully, as you learn them, you will improve your techniques, or maybe you will talk through with your pelvic floor physiotherapist about and make your pelvic floor exercises more effective and truly correct so that they serve your health and your pelvic health. Before we begin, I know that a lot of people watch my channel and they take tips and advice from it, and I'm super happy about that, but not a lot hit that subscribe button and the like button under this video. So if you're watching this video, if you're checking out my channel, and if you take anything useful, hopefully, from it, please subscribe, like this video. I would really appreciate it. And let's go now on to the mistake. Mistake number one: using every other muscle but not the pelvic floor. Pelvic floor is a specific set of muscles that sits at the bottom of our pelvis. Okay, this is female pelvic floor. Male pelvic floor is somehow similar with some anatomical differences, but the function is the same. So it's controlled toileting function, sexual function, stability function, reproductive function, and so on. So these are the muscles that we want actually to switch on. And the most common mistakes that people do, they either use their bottom or inner thigh. And how does it look in an exercise? The most classic version I can show you is the bridge exercise. So if I ask someone to do the bridge, and it can be any exercise of course, but it's just so visible in the bridge, and I ask the person, could you please lift slightly your pelvic floor whilst trying to engage. Now the engage I might explain differently depending on the person, depending on the gender, so we will talk about the cueing with them and to make sure that they understand, and maybe we do the internal exam so that basis is there. Or maybe they just came to me and I'm just asking them, do it for me as you understand. And later on I can explain to them. And the most common one would be pelvic floor squeeze, huge bottom clench here, and squeezing the inner thighs, okay, here and here. So you can see it from the bridge immediately. It would be like, oh, here, all right? Now, some pelvic floor engagement will be happening there. And I do sometimes use the compensation techniques in very specific cases. I have video on that, and often these cases are neurological patients, but not only. However, I would start to use the proper technique. So first we take our breath in, and then we think about a small blueberry around our anus. I use anus because it can apply to any gender, all right? But it can be also gender specific. It can be like, think about your scrotum, think about your testicles for a male, or think about the entry of vagina for a female. But let's use anus, all right? It's for everyone. So breathing in, think about your anus and there is a blueberry, and you gently pull that blueberry into anus. Or you think about holding the fart in, yeah? You gently breathe out, you pull it in, and you let your low back round, and you lift, and you hold that berry, and you hold that berry. There is way less gluteal engagement. There is some, because in this position there have to be, but compare this to this, here is more pelvic floor engagement, then here maybe yes, maybe no. All right. So I usually cue people to relax everything around. And this is the most common mistake, number one, I see. Mistake number two, and I've already mentioned it before, which is breathing. There is no breathing coordination whatsoever. So I ask people, can you please do a squeeze for me, a Kegel for me, the pelvic floor exercise you do, and it can be anything like, or they try to pull in on the breath in. So, and when I ask them, so what happens with the breathing? And the answer will be, I never thought about breathing. Do I need to think about breathing? Pelvic floor works together with our breathing diaphragm and core muscles directly. This is even how I check a normal pelvic floor movement and response for people on internal exam without even letting them know or asking them to do anything with the pelvic floor. I just ask them to breathe. And I see how much of a movement, it's not a lot usually, but there is happening with the pelvic floor and diaphragm. Whenever we breathe in, our diaphragm gets flatter, okay? It contracts, it gets flatter, it goes down because it needs to make space for the lungs so they fill in with the air. And when we have pressure on that pelvic floor, it drops slightly. When we breathe out, diaphragm relaxes and it goes up and we can lift our pelvic floor. So coordination happens with the breathing. So we breathe in on relaxing pelvic floor and breathe out on engagement. And this is it. This is your rule number one and the only one you probably need to know. And most common mistake number three is overuse of abdominals. If a person goes to any professional, and truly I'm not trying to bash anyone, you know, everybody are trying to help that person and it's very, very valid, especially if they do fitness, or maybe they found a YouTube video that they just decided to do and they get a lot of cueing, like feel it in the bottom part of your tummy, feel the gentle engagement of your tummy. There is no connection with the actual pelvic floor and people start to overuse their stomach. So it could be something like, if I ask them to contract pelvic floor or engage rather, it will be sucking in the tummy. And if I do the internal assessment, I can understand that there is a huge bearing down happening on the pelvic floor and the muscles themselves are completely asleep. There is no engagement. And of course, there is no breathing pattern. So sucking in the tummy or flexing, you know, bracing. Again, this is another way people think about pelvic floor and trying to engage the pelvic floor. And this is not a correct technique. You might not even get the pelvic floor because by the time you engage all those big strong abs, we have 4 layers of abs. Those smaller pelvic floor muscles, they will be under the pressure of those abdominal muscles, and then it's very difficult to find to engage them. And to be honest, I'd rather prefer you to over-engage your glutes in your inner thighs, where you still will get some pelvic floor activities, that over-tighten your tummy or suck it up. This will give very little, if any, pelvic floor activity. So those were your 3 mistakes, for 3 most common mistakes I've seen in my practice. Let me know if you did any of them. There is no shame in learning. I'm very glad if you watched this video until the end and you would go like, right, I should do this, and this way. If you learned something new for you, let me know in the comments. Thank you for your likes. Don't forget to subscribe and we will see you back very, very soon. Bye.